Hey y'all, and welcome to my channel. On this page, I talk about technology and money. Sometimes I also talk about hockey. That is new, so welcome. I know there's been some new subscribers to the channel, so welcome. I'm not sure what quite brought you to my channel, but I'm glad you found it. If someone shared my channel with you, thank you for that. Yeah, so I'm glad you're here. I know it's been a minute. Let me turn off this. Let me turn off this banner. Y'all just bear with me here. Let's see. Yeah. So for those, because you're watching this from the future, it's the end of summer, right? Today is Labor Day. So it's Monday, September 4th. So the summer is over. So I hope everyone had a good summer, a good Labor Day. If you had to work today, I just hope you had a good day. If you're able to rest, that's great. Yeah, so I hope everyone's been doing well. It's been a while since not only have I been live, but since I did a video, and I'll talk a little bit about why here soon. But today I wanted to do an AI and healthcare roundup, sharing some news articles that I have come across recently. I have a lot. I think I have like 7 or 8 to share. Of course, there's more. I may not get through all of it, but it's very purposeful why I'm talking about, why I want to talk about the articles, just the news that I'm seeing coming out every day. Right, every day there's some new innovation that I'm seeing or reading or hearing about with AI and healthcare. Because it's moving so rapidly and so fast. And I think I talked about this a little bit in the last video I did when I reviewed the book. Where's the book at? Oh, it's on my iPad. Yeah, when I reviewed the AI Revolution in Healthcare book, it's moving so fast. That book came out, I think, before the spring. And even the author said that AI is being integrated into healthcare, well, into really all industries. But I talk specifically about healthcare because I'm a registered nurse, but AI is being integrated so rapidly into healthcare that even when you read something or you like read about a large language model or etc., it may by the time you come across it, it may already be outdated. Very rapidly moving. Okay, so I just wanted to do a roundup of just what I've seen in the news about AI and healthcare articles, and especially the impact to nursing. The only reason I say the impact to nursing is because I'm a registered nurse, but it can impact, it is and can impact any position in healthcare, not just nursing, not just pharmacy, not just case management, not just physicians and advanced care practitioners. And even beyond healthcare. So here, I'm going to share my screen. Let's see here. Yeah. Okay. And start with an article. Whoops, just bear with me. What would be easiest? This probably would be easier. Let's see what we get with this. How's that looking? Okay, hang on. That doesn't look great. Let's do this. Okay, let's pull this out. No, let's leave that there. Thank you for your patience. Let's do it by window. It may be in my tab. It may be easier. Okay. Okay. Y'all should see that. Yes. You're seeing that, okay? Okay. Yes, you are. It looks like you are. Hopefully you can still hear me. But yeah, this first article I wanted to share here. Let me go away. So it might be a little bit easier to see. Oh, it really doesn't make a difference. I see. Okay. That's fine. Okay, so this first article I want to share is, now this article came out at the beginning of August, and it was very interesting to me. So MedExpress, for those who don't know, MedExpress is an urgent care center. So you think about something similar to like a Minute Clinic, like a CVS, or like the type of healthcare you might receive in an urgent care center adjacent to like a Target, or well, yeah, I don't know if Target has urgent cares or clinics yet, but I know what there are Walmarts who do, or the clinics that I believe Dollar General, they have those urgent care type centers. Yes. So MedExpress eliminated all of their registered nursing positions. This was really shocking because nursing as a profession is so high in demand, and to hear about a company that eliminated all of their registered nursing positions. And I know here, so like we have been talking about on this channel, other channels. I've seen articles about the importance of upskilling, no matter where you work, right? It doesn't matter if you're at the bedside in healthcare, whatever position you're in. If you're not in healthcare, you work in finance. I just saw an article maybe 15 minutes before I came on where Wells Fargo is closing even more branches of their bank. And I know there are branches of other banks that maybe not have closed their branches, but are limiting the lobby hours. So no, and I think I talked a little bit earlier this summer about fintech. So the people who work in fintech or the financial world, and how they're having to upskill. So this is why it's so important, no matter where you work, but especially for our registered nurses or licensed practical nurses. This is why it's so important to upskill. Now, this is something I never expected to hear about. So MedExpress, so it says registered nurses working for MedExpress in West Virginia said they were blindsided by the company after being told that their services are no longer needed. The nurses said the company told them that on September 7th, so that's Thursday, that's this week, Thursday, if you're watching this from the future and it's still within the same week, registered nurses or RNs would no longer be employed at the company. I just never would have imagined to see a healthcare facility saying that they would no longer be employing registered nurses. We spoke with 2 registered nurses who work for MedExpress. Both RNs asked that we keep their identities private out of fear of losing out on the severance package, but felt the need to speak up on the behalf of their fellow nurses and patients. So there is a video. Let's see if I can, where is the video? I was going to see if, oh, here it is. Sorry. Okay. I'm going to play this video. It gives a whole back story. Oh, and there it is. So let's get past this ad. So as this ad is playing, if you're still watching from the future, I just asked if you could take a minute to like the video, and also subscribe to the channel.
They were blindsided by the company after being told just on Thursday that their services are no longer required. 2 nurses told News Channel 3's Matt Lackeritz they are both shocked by the announcement and concerned for their patients.
A phone call 2 registered nurses say they never expected, telling them that come September 7th, registered nurses would no longer be employed at MedExpress.
It was kind of a shock or disbelief. It took me a minute to try to process.
There was no indication that that was even going to happen. We had no idea that that was coming down the line, so we were all shocked.
Both RNs asked that we keep their identities a secret out of fear of losing out on a severance package, but felt the need to speak up on behalf of their fellow nurses and their patients.
There will be that one time that they will wish they had someone with my skill set, my fellow RNs, and the patient is going to be the one who pays for that.
There's a lot of patients that come into urgent care that really need the registered nurse and their ability to assess their condition and situation.
We reached out to MedExpress.
So I'm going to pause there just to talk real briefly. Excuse me. Talk real briefly for those who don't, who may not be familiar. So you may know of like registered nurse position, a licensed practical nurse, or a licensed vocational nurse position, or a certified nursing assistant. All of those positions in healthcare have licenses. Like you have your CNA license or a nursing assistant, you have your LPN license, and you have your registered nurse license. They're all governed by a board of nursing to say this person can practice at this level of their profession, a nursing assistant, in this state, and these are the things that you as a CNA, LPN, RN can do. So there are things that a CNA does. There are things that an LPN does that a CNA cannot do. It's not within their scope of practice, right? It's not within, not to say it may not be within their skill set, but it's definitely not within their scope of practice. So, and there are things that a registered nurse can do that an LPN cannot do. In many cases, everything that a CNA and an LPN can do, the registered nurse can do, and even more, because it is within their scope of practice, and within their skill set, experience. The education is different. Doing a set, it's different, right? So it sounds like this company is eliminating nursing positions. Well, they talk about how they're changing their staffing models, but let's continue. It's less than a minute.
Asking for an interview and comment on these layoffs. In response, they sent a statement that says, MedExpress continually assesses and evolves our staffing models to better reflect urgent care industry standards. As always, we will support team members affected with job placement resources and seek to deploy them where possible to any open roles within the company. It's not yet clear how many RNs who work at MedExpress will be losing their positions, but we sent additional questions to their spokesperson to try and find out. Questions like, can you share how many RN positions are being affected in West Virginia? And we've heard that many of the lost RN jobs will be filled by another position. Can you confirm this? We are still waiting for a response.
Maybe doing, I'm thinking LPN
search for new
or
opportunities begins.
I feel like patient safety and loyalty to good employees should come over profits.
Matt Lackritz, WSIZ News Channel 3, Charleston.
So with that change in staffing model, so with this company eliminating RNs, I have a feeling, again, I don't know this company. I don't know anyone who works for this company. I have a feeling that they are changing. When they said they're changing staffing models, I have a feeling that they are replacing all registered nurses with either licensed practical nurses or licensed vocational nurses. It is a skill set. You do have to have a license to practice. There are things that you can do to care for patients, but it's a different type of skill set between an LPN and an RN. But that's just, I'm just guessing. When they said they're looking at their staffing models, I think it may also be a financial decision, right? Because registered nurses can practice at a higher level, like there's more within their scope, and that things, the type of work and care they can provide for patients within their licenses, that also means it's more expensive to pay a registered nurse versus paying a licensed practical nurse versus paying a certified nursing assistant. I'm just guessing. I don't know for sure. This is just what I am thinking is what happened. So this is why I've been saying for a while, for months on this channel, and I know other folks as well. There is another YouTube. Well, he has a YouTube, but I more so follow him over on Instagram. He calls himself the king. He calls himself the king of automation. He has a PhD. But he's been talking about, I actually saw him on Erica Williams' channel, maybe like a year or two ago, but he's been talking a long time about how automation, AI, just all of the changes like in manufacturing, engineering, is changing those professions where people are having to upskill and add to their skill set. No different from registered nurses. I never, especially in this healthcare environment, I never thought we would see the day where registered nurses are no longer being hired or employed by a healthcare facility, like an urgent care. So this just article and this news just reinforces the thought of always having to upskill, whether you're digitally upskilling, whether you're adding additional skills to your skill set. Because if you can have a healthcare facility that can eliminate all registered nursing positions and replace them with a different type of staffing model, that says a lot. That talks to me a lot about that there may be more of that to come, and you really just never know. So the next article I want to share, and I'm trying to get through, 15 minutes in. Let's see, is this interesting article that I saw on ChatGPT, and it's very short, on how GPT is, the performance of it is very similar to an intern or resident And we've heard that before, that it can do certain things in terms of helping with assessments more efficiently than actual intern doctor. I mean, excuse me, an intern or a resident. For those who don't know, an intern is like a doctor in training. They're in medical school. They haven't graduated yet. They're on the path. They may be a year 1 intern, year 2, year 3, year 4. A resident is someone who has graduated from medical school. They are a doctor, but they're still in some type of training depending on what type of specialty. But this research done at Mass General Brigham found that ChatGPT, now it doesn't say if it's GPT-3 or GPT-4. I'm assuming it's going to be GPT-3 since it just came out. I mean, since GPT-4 just came out earlier this year. I don't know. I didn't read the study, but it's just that ChatGPT is 72% more accurate at making clinical decisions, performing better at final diagnosis, and worse at determining possible diagnosis. And they did a study. So they said there's no real benchmarks, because you have to remember, all of this is new. All of this AI integrating it into the EHR, helping to optimize clinical performance and decision making for providers and diagnosing, et cetera. It's all new, right? So they acknowledge that there's a limitation, that there are no real benchmarks. But we estimate that this performance to be at the level of someone who has just graduated from medical school, such as an intern or a resident. So what the researchers did, they fed 36 published clinical scenarios into ChatGPT, asking it to come up with a possible or differential diagnosis, and then give additional information before requesting a final diagnosis and treatment plan. And they found that the AI chatbot was 77% accurate in its final diagnosis, 68% accurate in clinical management decisions, such as what medications to take, right? So like if you have someone who has a diagnosis of diabetes, it looks like the AI helps the provider or helps make suggestions on which medication, for example, in this case, which diabetes medication may be better for the patient may be best for the patient based on different scenarios, and 60% accurate in differential diagnosis. And then just to wrap this article up, it says, we are currently evaluating large language models, so that's LLM, solutions that assist with clinical documentations and draft responses to patients, with a focus on understanding their accuracy, reliability, safety, and equity. Because if you remember, we talked a little bit earlier this year, and there have been, for those who are familiar, there have been articles where patients can now email their providers through like a MyChart or some such similar. But if you are a provider, and I don't know how many patients a provider generally has they're caring for, but say if you have 200 patients and over half of your patients are emailing you all the time with questions and things like that, that could take a lot of time for a provider on top of everything else that they have to do. So on top of everything what they have to do. So what they're doing at this hospital or this health system is evaluating whether those large language models can assist with like drafting patient message responses to help reduce the burden of clinical documentation on the providers. And now I want to introduce a concept to you that's new to me, but it will tie into another story I'm going to talk about here in a minute. Let me just do a quick time check. And it's a concept of ambient clinical documentation and using AI to assist with that. So it says ambient clinical documentation, clinical intelligence uses advanced voice-enabled AI to automatically document patient encounters during a natural, free-flowing conversation between the physician, patients, and their family. So when you think about ambient clinical intelligence, the scenario that most immediately comes to mind for those who may not be familiar with how this could be applied, scenario example maybe when you go to the doctor for your primary care visit, there is a AI assistant, some type of AI component, speakers, audio, etc., in the room. So it is listening into your conversation with your provider. Your provider, like, how have you been sleeping? How's your alcohol intake? How's your tobacco intake? How's your weight management? How's your stress? And or as your doctor is examining you, they're not having to remember everything that you were telling them while they are listening to your heart, your lungs, your stomach, etc. You all can just have that conversation, and the AI, the ambient clinical intelligence, is listening and helping the provider, and it is formulating provider notes, etc., suggestions. So keeping in mind that concept, check out this next article here, and what Microsoft and Epic are doing, and there's another company, but I'll just focus on this Microsoft and Epic and what they're doing with that. So Microsoft and Epic, so for those, again, who may not be in the healthcare arena, Epic is one of the #1 electronic health records in the world. Cerner is another one. Now, I've heard folks say Oracle Cerner is #1, Epic is #2. I've seen it, Epic is #1, Oracle is #2. The bottom line is these are the top 2 EHRs in the world, like multi-billion-dollar companies. So Microsoft and Epic they're expanding their collaboration to accelerate generative AI's impact in healthcare. Okay, so what they're doing here is really interesting. So they're just talking about why they're doing it to help clinicians better serve their patients, and help with like reducing workforce burnout. I've done a video or 2 on that, on reducing the burden of physician documentation to staffing shortages. Let me just see if that's sharing. Okay, yeah, it is sharing. I just like to make sure. Let me just make this go away there. Okay, that way you can see the whole article. Okay. So what they're doing is they're expanding secure access to AI-powered clinical insights and admin tools within a wide range of Epic modules. So again, for those who don't know, Epic has multiple modules. So they'll have a module for like if you're admitted to the hospital, that's the inpatient module. They have a module that providers and nurses, et cetera, do their documentation in, very specific to if you have to go to the ER, if you have to go to surgery, if you have to go to the clinic. These modules are embedded in Epic, but they're very different from each other. So what they're doing, what they being Microsoft and Epic are doing is they're working to, it says rapidly deploy. That when I saw that rapidly deploy, that's why I keep saying, and I know other folks keep saying, like the changes with how AI is being continuously embedded into EHR, into workflows. It's happening so fast, y'all. I've been a registered nurse working in tech for 20 years. I've never seen a technology be so pervasive, so integrated, so tested, so many different things and different innovations coming. I've never seen it just come out so fast. Like it's just really happening fast. So they're working to rapidly deploy dozens of Copilot solutions that securely unlock the potential value that the Microsoft Cloud and their AI technologies enable as health systems strive to overcome the urgent staffing. So you think about that first article we saw where MedExpress is changing their staffing model because I've heard and read that registered nurses are very expensive to pay, or just staffing is a challenge. I think I've done a video or 2, or if you're in the healthcare arena, staffing is a challenge in healthcare because the human resources, from what I've learned and heard, human resources is your #1 biggest expense, paying your staff. So as health systems work to overcome urgent staffing, financial, and clinical access challenges they face today. So some of the things they're doing is enhancing clinician productivity with note summarization, enhancing clinical productivity with embedded ambient clinical documentation. So that was the concept I was just talking about like 2 or 3 minutes ago. And then in this case, Microsoft and Epic are looking to use Nuance's Dragon. So Dragon has been around for a while. I've known Dragon to be around at least for the last 15 years, probably longer. I've seen providers have the app on their cell phones, and instead of like a physician dictating to someone who writes their notes, or the physician having to write out and type every note, they just talk into a microphone. But the technology has evolved. So leveraging Dragon ambient experience technology, it's called DAX, which is already deployed within hundreds of Epic customers and supporting physicians. What they're doing now is using the AI technology of DAX embedded into Epic and Haiku mobile applications. So we remember how I said earlier, Epic has many modules. Haiku is another one of their modules. It's like Epic on your cell phone or a mobile app like a tablet. Further enhancing a seamless workflow experience for its users, driving administrative efficiencies through reduction in manual labor-intensive processes. Revenue cycle management is one of the many areas where generative AI can meaningfully improve efficiency. So revenue cycle, let's see, the best way I can explain it, revenue cycle is where is ensuring that the providers in the hospital, et cetera, gets paid and all the bills are paid, and managing the cash flow and the debits and the credits, et cetera. But it is very manual. Even the team that works in finance and accounting. Advancing medicine for better patient outcomes, and using like Slicer Dicer, which is one of their, I think their predictive model analytics platforms, but with the goal of using the AI for better patient outcomes. So it's really interesting, y'all. I thought that's why I wanted to talk about and share just all these news and articles and the impact to nursing. Again, going back to that very first article that I shared at the top of this video, where MedExpress eliminated all of their registered nurses. Like, they're no longer going to hire registered nurses. They are terminating. They have terminated all of the registered nurses for their healthcare centers. They announced it last month, but the last day for all of the RNs in their company is September 7th. They didn't say how many RNs work for their company, but with the healthcare climate like it is, it's just surprising and interesting to see a healthcare facility no longer employing registered nurses, because, as I mentioned, RNs are expensive to pay in comparison to like an LPN, licensed practical nurse, or a certified nursing assistant. So, we have seen in other industries like the fast food industry, retail, banking, etc., you have seen these companies cut back on their staffing, like eliminating staffing positions to put in more automated processes, but you haven't seen it for registered nurses. So to me, a trigger, registered nurses are now being laid off, like permanently laid off, right? Registered nurses positions are being eliminated because this company, as they expressed in this article, is changing their staffing model. That again talks back to the importance of continuously upskilling, whether you're digitally upskilling or if you are upskilling in other ways, like maybe going into a different profession. And that goes back to what I mentioned at the beginning of the video as well, why I have been the last couple of weeks haven't done as many videos, because I've been upskilling myself. I actually took a data science class, Emory Nursing. I had a data science certificate specifically designed to nurses to teach them how to work with large volumes of data, how to do data analysis. It was completely self-paced, all online. It took me a couple of weeks to get it done, only because I was also working. Some of the stuff in that data science certificate was stuff I already knew. Like, I already knew how to, like, I've done SQL, like I've written in SQL and done data analysis, but it also talked a lot about AI and understanding what large language models, et cetera, are. Now I've done that. I'm now taking a prompt engineering course for artificial intelligence. So doesn't matter how long you have worked in a profession, whether it is healthcare, manufacturing, et cetera, it's always important to digitally upskill. I have, only have 3 or 4 more articles to share, and then I want to wrap this up here in the next 10 minutes. So very similar to what Microsoft and Epic are doing with ambient clinical intelligence, Oracle Cerner is doing the same thing. And as I mentioned, Cerner and Epic are two of the largest electronic health records in the world. And so you see these multi-billion-dollar companies continuously here. Let me make myself go away so you can see it full screen. Oh, okay, yeah. You see these multi-billion-dollar companies integrating AI more and more into their electronic health record systems. And it just says to me, like, this article just came out at the end of August. Can y'all see that? Okay, let me make it bigger. When you see this, you think about, okay, if they're putting in all of these automated processes in these healthcare applications, what does it mean for the people who do this work manually or actually doing this work? So very similar to what Microsoft and Epic. I mean, as I always do, I'll be sure to link all of these articles in the description of the video after the live end, so you all can dive in a little bit more and explore. So very similar to what Epic is doing. Cerner is using Suki, which is an AI-powered solution for bidirectional ambient sync. So bidirectional means that the data flows in both directions. So instead of just the data flowing from point A to point B, the data also can flow from point B to point A. So that's what bidirectional means for those who may be unfamiliar. So it says Suki, which is the leader in voice artificial intelligence technology for healthcare, is announcing a similar enhancement for Cerner. So I'll just talk about what Microsoft and Epic are doing. So what Suki Assistant does is allow users to expedite the creation of clinical documentation with ease and efficiency, alleviating cognitive load and reducing documentation time. Now, they talk about, from what I've read, they just say clinicians. I don't know if this is just for physicians, but at least for registered nurses, like doing your documentation, this piece about alleviating cognitive load, I can see this being really useful for registered nurses, because you do like when you get an admission, a patient comes into the hospital, you do a full full assessment head to toe. You assess the patient head to toe, their skin, their heart, their lungs, their abdomen, etc. But as you're assessing the patient, you have to remember everything, what you're assessing. And then after your assessment is done, then you have to go back and remember, okay, the patient had edema in their feet. Their feet were swollen. The patient sounded like they had a heart murmur. You have to remember all of that. So using AI to help alleviate that cognitive load is huge. I saw that and I read that alleviating cognitive load, and I was like, my eyes just got big. If you talk to any registered nurse, LPN, CNA, they will tell you the times that they have written down notes on a napkin or a piece of paper or a paper towel, so they can remember in the moment and not forget and stick it in their pocket, hoping that they don't lose it. So when they sit down the document, so that cognitive load and documentation burden can be really big. So anyway, so wrapping this article up, with bidirectional sync, users can work seamlessly across Cerner to start and complete their documentation, giving them incredible flexibility in their workflow. They'll be able to easily reference patient chart data directly within the AI assistant, making documentation more convenient and efficient. They can do copy forward, which I think Epic already has copy forward. Copy forward means nothing has changed on this patient since the last time I checked them out. Everything is the same. Just copy what I already had and put it from 2 p.m. and add it into the 5 p.m. time slot. But it says, this announcement makes Suki the only AI-powered healthcare solution on the market that has enhanced ambient integration capabilities across multiple EHR systems, including Epic and Athena. So it sounds like their AI technology is agnostic. And when I say agnostic, it means like this AI assistant not only works for Cerner, it also works for Epic. That is good to have a software that is agnostic, because then you can plug and play it into different platforms, because the underlying technology is the same. I think it's so fascinating, y'all. I'm just so fascinated by this, even with this automated this ambient clinical intelligence, because when you go to the doctor and you're having a natural conversation with your provider, instead of your provider sitting at a computer and typing as you're talking, not looking at you, but looking at the computer screen, your provider can look at you. You all can have just a natural flow of conversation, and the AI is in the background listening, helping the provider, reducing that cognitive load, reducing their burden in clinical documentation, being accurate. So you told your doctor, my stress is 5 out of 10. The doctor has to remember that when they go to document. If they don't, they may roll, well, the patient's stress is 8 out of 10, right? So it just helps increase the accuracy of that. So the last 3 articles that I want to share in this AI healthcare roundup with news and article and its impact to nursing. If you're just joining now, this one is really interesting. It's a longer article, so I'll just very briefly touch on the beginning of it. I may not play the whole video. I know I won't read through the whole article, but this one was fascinating to me because this AI focuses on the patient. So let me just make sure that's sharing. Okay, it is sharing. Okay. All right. So this one comes from MIT Technology Review. I've talked about MIT Technology Review in other videos. I get a lot of my what's happening not only in healthcare technology, but just different industries technology from MIT. They really seem to be on top of what's happening on a daily basis. So in this case, this university, well, the title of the article is Brain Implants Help Create a Digital Avatar of a Stroke Survivor's Face. And so in this case, these researchers are using a brain implant, AI algorithms like large language models to help replicate patients who've had strokes, replicate their voices, and also even convey facial expressions via their avatar. Y'all, this one is so fascinating. Let's see if I can play it here. Here we go. I was watching it earlier. Let's see, is there an ad? No, there's no ad.
Today is an opportunity
Bigger.
for Anne and Bill to have a conversation through our brain decoding to facilitate what we think would resemble a future use of an actual real-life application of the technology.
We want to try to basically create a demonstration where we're decoding the text, the speech, and the avatar at the same time from Anne's brain as she tries to silently attempt to speak. We just trained some new models yesterday, so we might need to test it a little bit.
Okay. Just a little bit background. So this is a patient who she had a stroke about 20 years ago. And she has what they call locked-in syndrome, meaning she still has all of her cognitive abilities, but she's physically limited in terms of like her mobility and her voice. Okay, so the patient has locked-in syndrome, so she's not able to communicate with her husband, her children, her healthcare providers the way other people communicate. But she still has all the thoughts of she still has all of her cognitive abilities. That's very high level what locked-in syndrome is. Okay.
That's like,
Yeah, we'll run through some practice runs.
The device is an electrocorticography grid, which is attached to a pedestal, which is screwed onto the participant's skull. And it's the very first person to have this combination.
I think you are wonderful.
In the training lab, we really focus on restoring voice to people that have lost it due to conditions like stroke or ALS.
What we're picking up on are neural activity related directly to the attempts to move her facial muscles, and that's what we're able to decode into speech.
Hey Anne, how's it going?
It is good to see you.
Giving them the ability to communicate again with their loved ones and caregivers is really what we're looking to do.
I was thinking about running to the store.
What time will you be home?
In about an hour.
To not make me laugh.
That's the first time we've ever had a conversation using this system.
In order to communicate in her day-to-day life, she has an assistive communication device. These are dollar store glasses, and she interfaces with it using the little reflective sticker on them. It's very slow, and the device now is very old, but she relies on it.
For us to have that conversation using her Dynavox would probably be like a 5 to 7 minute conversation.
It was nice to have a conversation. I forget how slow this machine is.
When Anne was 30 years old, she was playing volleyball with some friends and had a stroke, which led to the condition that she has now, which is locked-in syndrome. At this point, she had a 6-month-old child and a 7-year-old child.
You are truly wonderful people.
The physicians have no idea why this happened. That was now 18 years ago.
Hand that to me, please.
How can we create technology that can help people really meaningfully contribute with all sorts of abilities?
Hi, how are things going?
Hi, Anne. Things are going fine. How are you feeling about the Blue Jays today?
Anything is possible.
Oh, you're showing not a lot of confidence in them today, are you?
You are right about that.
I guess we'll see, won't we?
I feel really lucky to work with a group of students and fellows and engineers.
All right, y'all, I'm going to stop the video there just because I see I'm running short on time. But again, I'll be sure to link this article and where you can watch the full video. But I just found that to be a fascinating use of AI and large language models. They do talk a little bit later in the video. This is the first time they've used AI in this manner, combined with a brain implant, along with like voice assistants, and also picking up like the facial expressions that the person is trying to make. So they integrate in not only AI, but also some other neurological or neuro technology. And I found it so fascinating, right? Again, it just speaks to, and they said she is the first patient. So that was the first time them recording the use of that technology and using it. But they talked a lot about, in later on towards the conclusion of that video, how it can be applied to not only stroke patients, but other type of patients who may have similar conditions where they may not be able to communicate in traditional like they used to. So the last one, I actually had 2 more articles to share. One is not an article. I had one more article in a podcast. Not going to play the podcast, but I found it really interesting, and it does connect. There is some correlation there with the last article, because I was just going to share the last article, but this podcast that I listened to called The Diary of a CEO, I've been listening to it for, I don't know, a couple of years now, like a year or so. But they had the new episode that just came out today. Caught my attention. I have listened to the whole thing. I'll leave a link to it here. So Google DeepMind. Google DeepMind is one of the world, they call it one of the world's leading AI companies. But the co-founder, his name is Mustafa Suleyman. He was on the Diary of a CEO podcast. Well, the episode released today, and he talked about, he being the co-founder of DeepMind, talked about how artificial intelligence, because it's in some manners, if it is utilized not in an ethical way, how it can be used to release a deadly virus, especially if that AI becomes more and more autonomous. So he talks about his background, but the topics they talk about is in this podcast episode is emotional responses to AI, the concern and fears. The conversation in this AI on this Google DeepMind, like, so you think about this co-founder of this leading edge AI company talk at length in this podcast episode about his concerns and fears about AI and how it is now released out in the world and the implications of if it got into the wrong hands, how it can, we just saw some wonderful ways that AI can be positively utilized for patient care, how it can automate processes and alleviate provider burden. But this in this podcast, he talks about the opposite of that. What if this AI, especially these large language models, you can, train them to do different things. What if they get into the wrong hands? He talks at length about that. And that, it was very concerning to me. The regulation of it, AI human interactions, quantum computing, cybersecurity challenges, and more. So if you have time, if you have an hour and 46 minutes, it's an excellent episode. But that ties into, so all of the concern and fears he talked about in this episode, it was really interesting because that episode was just released today. And I came across this article, and I'm not going to read through it just because I see I'm already tight on time. It actually came out at the beginning of August, and it talks about how these minority women have been trying to warn, it says warn us, but warning their companies, warning their colleagues, etc., about the dangers and the risk of AI. So they have been ringing the bell for like 5 years, 10 years. One of them got fired from Google. That's Timnit Gebru. She was on the Google's AI ethical team. I think she led a team of researchers around ethical AI and was going to release a research paper about it. And Google wasn't on the same page and she got fired. She said she got fired. Google says she resigned. But the point of it is these women, these minority women who work in this arena have been talking about this for years, either via the platforms, via research, etc., the warning signs, etc. But now, that many of them were penalized in certain ways or blackballed in certain ways, and they've been talking about it for so long. But now you're seeing people, for example, as the co-founder of Google DeepMind, now saying the same thing. And one of the things that the journalist in this article points out, these women, these researchers, you see them here, they're all minority women. They have been saying these things for years, and they've been penalized in many different ways. But one of the things that the journalist pointed out, what if we would have listened, or we, when I say we, not me, but the collective, what if we had listened to these women 5, 10 years ago 15 years ago, when they first started talking about the risks, the dangers of AI? We wouldn't be where we are today. And hearing the things that, for example, this co-founder talked about on this podcast today, right? I just found it fascinating. Wanted to do a quick roundup. The key takeaways from this live, I've talked about it before. Other folks have talked about it. Erica Williams talks about it on her channel. If you don't know, she has a great channel. She's actually an entrepreneur. Her channel is Erica Williams, The Classy Climb. She's been talking about AI and automation, et cetera, from a business standpoint, not from healthcare, but she's had, and I forget his name. He calls himself the king of automation. She's done several episodes with him, but he talks about AI and modernization from like the manufacturing engineering standpoint. But again, I tie all of these articles in this roundup, I tied back to that first article I shared where the company eliminated all registered nurses positions, and how, folks have always felt that nurses, physicians, people working in healthcare are not golden positions, but the type of positions that companies would never get rid of. Because you always heard, we'll always need nurses, we'll always need teachers. But now we see how AI and modernization and innovations are now to the point where healthcare companies are like, well, we don't need registered nurses, and eliminating all those. And it just talks to the importance of continuously upskilling ourselves, whether digital upskilling, getting new key skills added into your skill set. Yeah, I've been a registered nurse working in tech for 20 years. I'm not sitting on my experience because you just never know. Innovation is happening too fast in healthcare with AI, with other technology advancements. It's happening so rapidly. So we just have to prepare ourselves. And that's it, y'all. If you're watching from the future, you made it this far in the video. And if you haven't, please consider liking the video. If you found this live very helpful or any articles very helpful, share the video with your friends or your network. I would appreciate it. I'll leave my contact information in the description. I think it's already down there. I always love hearing from folks, as long as it's respectful, etc. And yeah, that's it, y'all. That's the end of this live. And I'll see you in the next video.